Hello, everybody. New Manchester here, back with another video. And this video is strictly for Americans, people who live in the all 50 states and all territories. This video is for you. This video is for all of you. Now, all of you remember that when Barack Obama was president, he signed into law the Affordable Care Act in 2010, and is a good step in the right direction, but it didn't solve the problem of solving the problems in the healthcare here in America. Co-pays and deductibles, bills. Denying care if you denying care if you can't afford it, or if you don't have any insurance at all. In this video, I'm gonna pretend that I'm President Obama, and instead of going for the Affordable Care Act, I'm gonna go for a universal health care system that will cover everybody in America, and there will be nobody who won't have any health insurance. And this healthcare system that I got written down on paper, it is titled AEHS. AEHS stands for American Eagle Healthcare Service. And as President Obama, I'm gonna go on TV and tell you about this healthcare system before I sign it into law. And I'm gonna read it. And I'm gonna pretend I'm him saying what I'm saying on paper to you on TV. Okay, here it goes. The AEHS is a national single-payer universal health care system that is free of use and paid for through taxation. The system is a Medicare for all system that doesn't just cover the elderly / people 65 years of age and older. It will cover people of all ages. It will cover the young, old, rich, poor, the disabled, and children. That means it's going to cover everybody. People of America will receive their AEHS health care through public funding, with spending decisions made at the federal level. The AEHS health care is free to people who use it without no money out of pocket. Under the AEHS, people will use a healthcare card to get healthcare services. And here how the card is going to look. The AEHS healthcare card is a card issued by the U.S. government which evidence the entitlement of the cardholder to get prescription medicines, medical services, and other things they need free of charge. The card is issued after an applicant has successfully applied at a AEHS healthcare card center near the hospital. The AEHS healthcare card center is a place where you can go and sign up for the card and get your picture taken. It's like going to a DMV or a place where you renew your driver's license or just get a new driver's license when you renew it. It's kind of like that. You get your picture taken, take a thumbnail, and you just wait in the mail until your AEHS healthcare card arrives in the mail. Okay. The card is issued after an applicant has successfully applied at a AEHS healthcare card center near the hospital. And the card will be good for 5 years and can be renewed for the holder. After the card holder renewed the card by getting a new one, he/she can continue getting AEHS services. If they move to another state or territory, if they move to another state, the card is good. It is good at any state and at any unincorporated territory of the United States. If someone loses the card, they can get another one. It's like this. If you lose your healthcare card and someone gets it and use it for identity theft purposes, it's going to have a chip in it, and if they try to modify it and use it, the card will be useless. The card will be useless. But actually, if someone uses the card, and they see that it's been modified, they'll count the people at the hospital that you go to get your health checkup or surgery or whatnot. They'll identify. They will call the authorities and have them arrested. So yeah. So that's how it's gonna go. Okay. If they don't have one, they will continue to get services, but they need to have that card. They have all month to get services without a card. At the end of the month, they will pay a fine of $5 by the AEHS. That card. Yeah. See, they get service. See. Yeah. Technically, if you don't have a card, if you don't have a card at all, yeah, if you don't have one, you can continue getting services. You continue getting services through the entire month. But after the month is over, and you go to the next month, you'll get fined $5. So yeah. Okay, here's more. The AEHS will cover maternity leave, dental, getting glasses, laser eye surgery, laser vision correction surgery, or LASIK, and any surgery that will cost $0.00. It is all covered by the government. Back to the AEHS card. When you go to the doctor, you will show your card to a nurse. The nurse will say, "The doctor will see you now." The AEHS will have wait times. If you don't like the hospital that you're in, you can go to another one. You can go to anyone you want. If you get hurt in a car crash or get sick, you will be picked up by an AEHS ambulance or a helicopter and taken to the emergency room high speed. Basically, the ambulance and the helicopter will be at your location on the double. Okay, like you live in a rural area, the helicopter will come by quickly. The people, yeah, the EMTs, the paramedics will get you, put you in a helicopter, and take you to the hospital / emergency room quickly. You would get there very, very quickly. And also there's going to be tons and tons of ambulance that are yellow and they had the AEHS logo on them. They will be everywhere, all over the place. I mean, they will be everywhere. There'll be ambulance everywhere in this country. Someone gets hurt, someone gets sick. Or a woman goes into labor and getting ready to have a baby. The ambulance or a helicopter will get to their location quicker, pick them up, and take them to the hospital quickly as possible. They will get there no time flat. They will get there lightning fast. Okay. In the waiting room, people will be put in the waiting queue to see the doctor. Those who got hurt in a car crash, break their legs, arms, or having a heart attack, they will be seen on the double. That means they don't have to be in the waiting room. It's like this. If you get in a car crash, if you get hurt, or if you get sick, if you get sick or get in a car crash, or if you get hurt, you will be taken. You will be taken immediately to the emergency room. You will be seen immediately. You won't be put on a waiting list. You won't be put in a waiting queue at all. But if it's a simple health checkup, or you just go there for a simple health checkup, you can be waiting longer. So yeah, that's how that's going to go. The doctor will see you for free, treat you for free, and your drugs are free from that doctor. Also, you can buy your drugs at any pharmacy store for $2. Filling prescriptions will be free of charge for young and old who have a pre-existing condition. You will get free everything in the AEHS. Everything is free. You will get no hospital bill. After you see a doctor or nurse at the hospital, you will receive $100 at the cashier room. That means when you get ready to leave, you will get paid at the cashier room. You will receive $100. And that will be from getting a ride. They'll be getting a ride for they'll be getting a ride in a taxi, and also the money is from your taxes you pay. When you pay taxes for your health care, you will get that back in that money. It also doubles as money for paying for a taxi ride home. Or if you people have a car, you can drive home. You can use the money to You can save the money. You can use the money. You can do whatever you want with the money. I mean, it's up to you. I mean, but that money is from your taxes. Okay. Money will not go in. Money will come out for you for a taxi ride home, and money back from paying taxes for your health care. If a woman has a baby, the AEHS will send nannies under the government to clean their house, cook food, and do their laundry. The AEHS is free of use and paid for through taxes. No bills. So you guys got to understand this. I mean, it's not a charity. I mean, you guys are paying for this as taxpayers. And we pay for this through taxes, you will have no worries at all. So you got to take this very, very seriously and don't abuse it. The government is the single insurer, and the country will save money by spending less and covering everybody. The AEHS is a type of universal health care financed by taxes that covers the cost of essential health care for all U.S. residents, with costs covered by a single public system, hence single payer. So that's the AEHS in its entirety. So this healthcare system will be way better than a broken, bureaucratic, cash-sucking middleman private insurance healthcare system that we have here in America. This healthcare system that we currently have right now is broken. It is broken. And you know, I remember someone told me that universal health care is straight out of Hitler's playbook. And that is just complete and utter bullshit. I mean, Hitler, all he cared about was killing people. He didn't all he cared about was killing people in Nazi Germany, and he didn't care about the health and the well-being of the people. I don't know nothing about Nazi Germany, and I know a little about Adolf Hitler. Well, actually, I know a little about Nazi Germany, and I know a little about Adolf Hitler. So yeah, as President Obama, I mean, after I sign in the AEHS into law in 2010, people will get good quality, universal, single payer, national health care coverage. And before I talk about this to the people, I'm gonna say this to everybody, in a room in the White House. I mean, I'm gonna say this at every press conference. I'm gonna say this: Medicare for everybody. That's what I'm gonna say. And I'm gonna talk about the AEHS. And before that, I'm gonna put it together and talk about it. And I just talked about it on national TV to all of you. And after I talk about it on national TV, I'm going to sign that healthcare law into law. Yeah, so the Affordable Care Act was a step in the right direction, and Donald Trump took it and just destroyed it. The healthcare will be that healthcare system will be available. In an alternate time, we will have this healthcare system right now. I mean, all of you in all 50 states you're gonna see AEHS, yellow helicopters and ambulances with the AEHS logo and the eagle on them. In all of your hospitals, in every hospital all across the country will be under AEHS control. And the AEHS logo will be on every hospital all over the United States of America. They will be everywhere. 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 So I hope you enjoyed this video. I mean, if you like the video, go ahead and like it. If you dislike it, dislike it. And go ahead and sub to me if you want to. Alright, this is the new Manchester saying this. Thank you for watching, and I'll see you later. Take care. Be safe. Bye. Oh yeah, one more thing. I mean, before you queue up in the waiting room, you're gonna stand in line, and when you get you stand in line, when you get to the desk, I mean, you just give your name and your date of birth, and you show your AEHS healthcare card, and they'll say the doctor will see you now, and they'll give you a number. So you go and sit in the waiting room and wait. When they call your number, you can go see the doctor. I mean, you'll hear this number something something something, number something something something. If that's your number, you get up and go see your doctor. So yeah, just want to add that in. Also, let's see. Yeah, and the taxes for the AEHS healthcare system in America. I mean, the taxes are going to be high. I mean, the taxes are going to be raised for both rich and poor, but there's going to be a difference. I mean, the poor are going to pay higher taxes, but the rich are going to be paying even, and the rich are going to be paying an even higher in taxation. So the rich are going to be taxed more because they have a lot of money. So yeah, after I, who is President Barack Obama, the 44th president of the United States, after I sign in the healthcare law, the universal healthcare law, which is the AEHS, which done through the healthcare reform. The system will be signing the law, and everybody in America, everybody in 50 states, including territories, and Puerto Rico, will receive NHS Britain style healthcare under the AEHS healthcare system. So that's a sane, civilized healthcare system for everybody. So that's basically Medicare for all. I mean, it doesn't matter if you're rich, poor, young, old, disabled, non-disabled, homeless. The healthcare is available to you free of charge and paid for through taxes. So yeah, so that's it. All right.